Recording in progress. A very good morning and good afternoon to your ministers and representatives. Before we start, I would like to make an announcement. Before we commence, proposed resolutions and decisions, also called conference papers, have been uploaded on the Regional Committee web portal. These were prepared by the rapporteur. We will consider the proposed resolutions after the coffee break today. Let us move to item 9, panel discussions on primary health. We will resume our considerations of agenda item number 9, panel discussion on primary health care. May I now call on the Secretariat to provide a summary of our discussion on this important topic over the last few days and to respond to the points that have been made.
Thank you very much, Vice Chairperson. Honourable Ministers, respected delegates, good morning, good afternoon, good evening to you all. I'm going to provide you with a summary of the panel discussion, the field visit and the Member State interventions on the primary healthcare agenda item. I think the very short summary came from the Minister from Singapore when he reframed the question that we used and said to us, instead of thinking about the future of primary healthcare, he said the future is primary healthcare. So quickly turning now to the panel discussion itself, you'll recall we had an intervention from the Minister from Vanuatu and then conversation between the ministers from Singapore, New Zealand and Tonga. In that, they all emphasised the centrality and the importance of primary healthcare in their national health plans for the future and the importance of primary healthcare for achieving universal health coverage. As I just said, the Minister from Singapore spoke about the importance and said that the future is primary healthcare. The Minister from New Zealand spoke about the real importance in their plans of making sure that all populations benefit and that there is really important, meaningful community engagement and work with Indigenous leaders to create the healthcare that is needed. The Minister from Tonga also spoke about the importance of community and primary healthcare working with community, and she also emphasised the importance of working with other sectors. She highlighted in particular food and food security as an important intersectoral issue that relates to health. Then we had, for those who were here in Himeji, a visit in the afternoon to Ieshima Island, where we had a fantastic opportunity to look at localized primary healthcare, rooted in the local community. This is a community whose economy is dependent upon fishing and mining on an island about 20 minutes from the mainland. We saw innovation and grounds-up solutions based for local service delivery according to what was needed in the local service delivery model. That included specially adapted, very narrow but highly equipped ambulance that could deal with the narrow and steep roads on the island and be the basis of primary healthcare delivery, but also with a very quick, well-organized referral system with an ambulance boat to be able to transfer quickly to hospital on the mainland if necessary. This reminded us, I think, not just of the need for localized models, but also that when we're thinking about primary healthcare, we cannot do so without thinking about it as part of the broader healthcare system. And this also provided us an opportunity to have informal discussions on other localized models of primary healthcare that exist across the region. Then turning now to the member state interventions, we had many member state interventions, and I'm going to group the summary and response under 3 main categories. So the first is, why is the new primary healthcare so important? I think some of that is self-evident, but it's worth restating. Many member states spoke about the increasing burden of non-communicable diseases, the demographic shift, rapidly aging populations, the long-term chronic care needs that require new models of healthcare, and a number, of course, also reminded us of the ongoing need, for example, for mother-child health. So we heard this from a number of countries. We heard that that requires a shift away from disease-based interventions to models that are more focused on preventing and promoting health, away from episodic care to lifelong engagement, intervening before and not after. We heard that from many member states. And we also heard that why is primary health care important? Because that is a vehicle to reach all populations and the vulnerable. It's really important to do so. And that also it is a way to do so that can entail reducing financial risk of populations, an important need and an important driver. Finally, we heard from a number of member states about the financial sustainability concern for healthcare systems and the importance of new and stronger primary healthcare to make the healthcare system more financially sustainable. And a number spoke with regards to that about improving referral systems and reducing readmissions as part of that. So in summary, for that first part, why is primary healthcare so important? There are a number of factors that primary healthcare is integral to new health plans and strategies that member states are developing to deliver essential public health goods, but also a strong recognition that primary healthcare service delivery models need to be different to deal with these new challenges. Secondly, we heard many interventions that spoke about the implications of COVID-19 and lessons that have been coming out from the response to COVID-19 for primary healthcare. First in that, of course, was the important role that primary healthcare has played in the COVID-19 response, both in terms of the care for patients that it plays a role in immunisation increasingly, and also many member states spoke about the vital role of primary healthcare in maintaining routine essential health services throughout the COVID pandemic. We also heard, and I think this was one of the largest areas where we heard interventions, about the many innovations and changes in service delivery models as a result of COVID-19 and how primary healthcare had adapted and evolved quite quickly. We heard that about e-health and telemedicine, about online prescriptions, online booking for vaccinations and for appointments, the evolution of electronic health information systems, new data sets that have been developed quickly and rapidly, and also the role of primary healthcare and rehabilitation. There was a lot that we heard about how service delivery models are changing and innovations that had existed previously were being taken on more dramatically than previously. Third, and finally in the summary, we heard many member states talking about what will be needed, what will be required to create the primary health care of the future. So we heard a bit about why it was important, what it needs to look like, and then what it will take to create that future. A number of member states spoke about new models of service delivery that were beginning to exist or that would be needed to deal with those public health challenges, the longer-term chronic conditions. We heard about the opportunities that exist for individualized primary health care, about predictive primary health care. We heard, as I said at the start, a lot about the importance of engaging with the community and engaging with Indigenous and local leaders. Many member states spoke about the importance of primary health care being rooted in the community and responding to the community and engaging with community. We heard also about the importance of working with other sectors, with social care issues, food and nutrition, and mental health as well. And I think that came out as well in the side event on mental health. And we then also heard, of course, about a reminder of what primary health care will need to be looking at, the need for it to be holistic and comprehensive, preventative, promotive, curative. We heard about the importance of rehabilitation and palliative care as well. And then lastly, in the summary, a number of member states underlined the importance of some of the ingredients on which we would need to work to be able to develop this primary health care of the future. We heard about the extreme importance of referral pathways to and from primary healthcare and other healthcare services, and how COVID itself actually had opened some opportunities on this because of the needs in the healthcare delivery. A number of member states emphasized the importance of a health workforce. I think this came through very strongly, the importance of a trained health workforce at primary healthcare level, many different disciplines. At the conversation between the ministers at the start, we heard about the importance of getting the financing right, about paying for health outcomes, not for inputs, and about aligning payments, payers, providers and patients, the 3 Ps the Singapore minister called it, and I think a number of other delegations picked up and also spoke about this. And then lastly, something that we heard that is important for the new primary healthcare, but where there is a lot of opportunity right now, is digital health and health information systems to underpin a stronger primary healthcare system where they can be backed up, and where also digital health and health information systems can not just underpin but can potentially be a driver to support those new primary healthcare systems. So that is a summary, I think, both of the panel discussion itself, our field visit here in Himeji to Ishima Island, and member state interventions on why new models of primary healthcare are so important, what we can learn from some of the COVID experience, and then what some of the drivers and ingredients that we will need to be looking at in the health system organization in order to be able to deliver that new primary healthcare. I thank you all for your contributions to what was an extremely rich discussion, which will help us in Wipro take forward our thinking and work with you on primary healthcare. And with that, I pass back to you, Vice Chair.
Thank you, Director of Health Systems and Services, Mr. Martin. This concludes our consideration of these agenda items, and thank you. Now let's move to item 15, coordinations of the work of the World Health Assembly, the Executive Board, and the Regional Committee. Now we will resume our considerations of agenda item 15. First, we will hear a summary excuse me, from the discussion over the last few days on item 15.2 regarding WHO's works in countries, and 15.3 regarding sustainable financing. Following this, we will consider the remainder of item 15.3, including an update on the concept and scope of revisions for the program budget 2022 to 2023. Lastly, we will consider 15.1, agenda for the 73rd session on the Regional Committee. Now let's hear a summary of yesterday's deliberations on item 15.2 and item 15.3. I would like now to hand over to the Secretariat to say a few words, and then invite the Chair of the Working Group on Sustainable Financing, Mr. Kumar, and the Vice Chair, Australia, to take the floor. Dr. Cabuano, the floor is yours.
Thank you, Mr. Vice Chair. Good morning and good afternoon, distinguished delegates. I won't speak for long, but I want to thank the distinguished delegates for your intervention and engagement on these two items combined, item 15.2 and 15.3 on sustainable financing. It was excellent to hear that you found it useful to have these two items taken together. The Working Group on Sustainable Financing is a member state-driven process, but the decisions that result from this process have critical implications for our work in and with countries. More sustainable financing, and as mentioned by some of the distinguished delegates, if it is allocated equitably and built on the current level of resources made available to historically disadvantaged regions and sub-regions will allow us to provide long-term support using a systems approach to support countries to sustain hard-earned health gains as traditional withdrawal, and it will allow us to act today for the future. Thank you, Mr. Vice Chair.
Thank you very much, Dr. Capuano. We are fortunate to have Mr. Kumo, the chair of the working groups on sustainable financing, joining us again from Berlin, where it is the middle of the night. The floor is yours, Mr. Kumo.
Thank you, Mr. Vice Chair. And indeed, I would like to echo the words of the Secretariat. It was a very rich and important debate with 17 member states taking the floor and one written statement that was submitted. We heard 2 sessions on the agenda item. So member states were able to attend in the morning or afternoon, depending on their time zone. And indeed, member states specifically thank the WHO Secretariat in the Western Pacific for combining the discussion on sustainable financing with the session on WHO's work in countries, which has been key to help demonstrate how sustainable financing is a critical enabler for WHO's ability to provide tailored support and deliver results at country level. I will very briefly run through the 17 or actually 18 statements and try to give a response to those questions that were brought up. So first, Kiribati, you focused on the country-centered approach. You highlighted most concerning about WHO's financing. WHO must further be enabled to serve the member states, and you expressed strong support to sustainable financing, finding a solution. Tonga, you highlighted the need for a strong, independent WHO, but you also at the same time said sustainable financing must be translated also to the needs of small island developing states. And sustainable financing is critically important to achieve the results at country level, and therefore highlighted again the need to combine both discussions. Yes, you expressed support for the base segment being funded by 50% ACs, but absolute clarity about the allocation is needed, and there needs to be a gradual increase, taking into account the fiscal constraints that we see in the different member states. And you expressed support for exploring the modalities of a replenishment model. However, benefits must be equitably shared among the 3 levels of the organization. Cambodia, you also highlighted that a flexible approach is needed and showed your strong support for an increase in assessed contributions and flexible resources. You highlighted that it's critical for WHO to have more flexibility, which we heard from many member states. Samoa, you focused on the one team approach, supported the base segment being financed by 50% through ACs, support that the entire base budget should be flexibly financed, however, in an incremental approach, and raised and clarified that with others that with regards to the replenishment model, there need to be further questions answered how this model could be adopted to the WHO. The federal states of Micronesia highlighted the high importance of the work of the working group. Again, support to the base segment being financed through 50% assessed contributions, support to the base segment being fully flexibly financed, and an incremental increase. You also brought in the notion that the return on investment is much higher through these flexible assessed contributions, and you expressed your support for replenishment, but that further discussion would need to happen on the replenishment model. New Zealand, you clearly articulated we must fund WHO to do its job, and you showed that there's an imperative to act in consensus. I think the spirit was in the room in both sessions. WHO needs to step up its position as the leading coordinating agency in global health architecture. And you highlighted that there needs to be a link to the work of the strengthening working group that is working in parallel, and that will meet next week in Geneva again to discuss its report. You showed your support to the AC increase, which you felt is necessary to safeguard the integrity and independence of the WHO, support to more flexibly financing the WHO, and you highlighted that the next World Health Assembly following the special session, so the one that will meet in May, should set the way forward and support to the replenishment model, or to explore the replenishment model. US, you appreciated or expressed appreciation to the work of the Sustainable Financing Working Group. WHO must become stronger. The goal is sustainable financing. We need to be better in setting priorities, you highlighted, and there needs to be clarity about the added value that the increase can bring. And I think there it's important to link it again, or it was very good to link it with the work in countries, because that clearly showed the added value that more sustainable financing can bring to WHO's work, in particular in the country setting. You highlighted that there needs to be a link to governance reforms and the initiatives that have been put on the table, including the standing committees, in particular on health emergencies, and the proposal on governance. And there needs to be a coordination between both working groups. Australia, focus on making WHO fit for purpose, support for an ambitious increase in assessed contributions to fund a high proportion of the base segment. The WHA needs to set the direction for an incremental increase, link it to key reforms on governance, ensure additional funding for regions and countries, replenishment, but further work is needed. Member states must remain the key drivers of the WHO. Japan, you highlighted that this is a critical debate. Enhancing governance, accountability, and transparency is key while we are moving forward with better financing the organization. Note simple questions. Absolutely, I'm with you. You brought up the question, which is of highest relevance: how large should the budget be? How much of this should be funded by the assessed contributions? And I think there is no easy answer to that. And certainly, I'm not the one who can provide you with the answer, but the World Health Assembly, or the EB, needs to bring up the answer. So which base segment are we talking about? And from my point of view, it's certainly the World Health Assembly in May will decide upon a new program budget, the program budget 2020-2023. And I think what we are discussing is the 50% AC of that base, practically taking that as the basis for an incremental increase. However, obviously being clear that all increases will come incrementally, so not at one time, but setting more or less the path forward to reach a target that might be set on the basis of the next program budget. You highlighted the importance of bringing in finance ministers. I think that is absolutely key in order to move forward. Solomon Islands, importance of sustainable investments in the health sector overall, in particular in small island states. Fiji, you expressed your support to shift more sustainable financing to the base segment, highlighted the importance of sustainable financing for WHO's work on the country level, in particular in areas which are currently severely underfunded, like the work on NCDs. More predictable and flexible funding is key for WHO. The way WHO is being financed must change, you clarified, and your support for the base segment being funded by 50% ACs. You asked the question, what does this mean for each country in concrete terms? And indeed, the Secretariat in Geneva has brought and is able to provide you with the absolute figures based on different scenarios, which obviously depend on what the EB and potentially then the World Health Assembly decides. But I think there needs to be absolute clarity. What would this mean for each individual country? And the Secretariat can provide you with these figures and is willing, obviously, to do so in the discussions. Then Republic of Korea, again, support to an AC increase and more flexible funding. Efficiency and accountability must be ensured. I think we hear that loud and clear, that while we are investing more, at the same time we need governance, accountability and transparency to be ensured. But from my point of view, this is why the work of the two working groups is so interlinked. So the working group on the strengthening, where proposals have been tabled to really bring accountability, efficiency and governance forward. Malaysia also expressed a strong statement for an AC increase. I think it's also important, as you mentioned, think outside the box. We need to be innovative in our solutions. China, sufficient and stable funding is needed, what we currently do not have adequately enough. You expressed your support to increase the assessed contributions and flexibility of voluntary contributions. Priorities must be matched with available resources. We hear that loud and clear, and more transparency of the funding is needed. Philippines, you expressed your support to the IPPPR recommendations, also to exploring the replenishment and the AC increase. However, this needs to happen in a gradual increase. Vietnam, strong support for the solutions on the table. Singapore, I liked it how you put it. A logical proposal is the base segment being financed by 50% assessed contributions. Budget approvals should be linked with the availability of resources. You expressed your concern regarding the applicability of a replenishment model for WHO, and we need to look at that more in detail. Absolutely right. Full flexibility is needed, a more pragmatic approach. You highlighted moving away from tough earmarking could be to earmark at a higher level and to only allow that. And you brought in the proposal to do this based on the triple billion targets. And you highlighted the need for strong fiscal discipline. And as I mentioned, apart from the 17 statements that we heard in the two sessions, there was one written statement from Vanuatu, and I will bring that to your attention. Also, Vanuatu expressed its support in the written statement to an AC increase, also the support to moving to more flexibility and the need to have clear definitions of the essential functions of the WHO. And with that being said, I'd like to again thank all member states for their rich, valuable contributions and the strong support that I hear coming from this region for the proposals at the table and the work of the working group. Obviously, many questions also being raised. I've tried in my reply now to bring them up and answer some, but I'm obviously available for any further questions that will come up. So thanks a lot. I think this session or the two sessions really provided us with the support that we need in order to move forward in consensus. Over from me so far. Thank you.
Thank you, Mr. Kumo. I'd now like to call on the Regions Bureau member, Australia. Australia, you have the floor.
Thank you very much, Vice Chair, and thank you to Björn and Corinne for your opening comments. Good morning, good afternoon, ohayou konnichiwa gozaimasu, honourable members, RD, colleagues. On behalf of Australia in its Working Group Bureau capacity and Ms Bronwyn-Field as the Western Pacific Region Vice Chair, can I echo thanks, really sincere thanks to fellow member states for thoughtful and considered contributions to the debate. As a member state-led working group, it's really important for us to hear a breadth and diversity of voices, which I think we did during this week's debate. What was particularly striking for me was the resonance between WHO's work in countries and the importance of the organisation being sustainably financed to undertake the important work that member states expect of it. As we flagged earlier this week, a summary of the important discussion among us on sustainable financing will be prepared, and together with the WIPRO Secretariat will ensure that this is shared with you all via email soon. And finally, and if I can call on colleagues in the WIPRO Secretariat just to flash up the slide. Yeah, thank you very much. Can I remind that at the core of the working group's mandate, so i.e. the way ultimately our views as member states will be given effect or will be heard, is via the working group's report to the 150th session of the Executive Board in January early next year. And so the call for written inputs to the zero draft of this report, as I mentioned before, was delayed as much as possible to ensure that it accommodated our region's debate this week, but the deadline is today. So yeah, if I can just remind anyone who's kind of watching on screen and hasn't yet had the opportunity to provide those written inputs, the deadline's close of business Geneva time today, Friday the 29th, and to Hewitt Mackenzie, who is part of the PRP team in the Secretariat. Thanks very much. I'll leave it there.
Thank you, Mr. Kumo and Australia. We really appreciate all your efforts. Honourable Ministers, during yesterday's interventions on item 15.2 and item 15.3, many of you had questions, and Mr. Kumo has kindly agreed to take your questions. If he has not already answered these questions, please press the button on your microphone or raise your virtual hand if you wish to ask Mr. Kumo or Australia a questions. We will take all the questions together before handing over to the chair to respond. Thank you. Any representative would like to respond or have any questions? I see none. There are no questions, so thank you very much, Mr. Kumbo. We will now consider the remainder of item 15.3, including the updates. Let's give the floor to RD. The floor is yours.
Thank you very much, Vice Chair, and I apologize to intervene your moving towards next agenda. I just wanted to thank our Chair, Bjorn, for your leadership and try to really listen every member states in these discussions. And also wanted to thank Australia, your commitment to represent us. We've been observing wonderful work by Australia. And again, thank you very much for all the interventions made by the member states. I can feel those global discussions in our regions come together with the actual work that we're doing on the ground. And this is still ongoing discussions, and I hope that our member states can contribute in this global discussion so that we can make these organizations much stronger in serving the people. So Bjorn, I know that it's midnight or early morning, but really thank you very much for your contributions. And I'm looking forward to continue work with your working group. Thank you very much.
Ministers, we will now consider the remainder of item 15.3, including the updates on the program budgets 2022 to 2023. I call on the Secretary to introduce the remainder of 15.3. Dr. Capuano, over to you.
Mr. Vice Chairperson, distinguished representatives, in continuation of discussion on the coordination of the work of the World Health Assembly, the Executive Board and the Regional Committee, I would now like to refer to Section 3 of the working document WPR/RC72/9. This year, 10 items have been referred to regions for further comments or consideration by Member States in 2021 prior to governing body sessions in 2022. Separate consultation processes have been used to obtain Member States' input or comment on 6 of these items, namely World Health Assembly Resolution WHA 73.10 on global actions on epilepsy and other neurological disorders, World Health Assembly Resolution WHA 74.4 on reducing the burden on non-communicable diseases through strengthening prevention and control of diabetes, World Health Assembly Resolution WHA 74.5 on oral health, World Health Assembly Decision WHA 74 in brackets 11 on the role of the Global Coordination Mechanism on the prevention and control of non-communicable diseases in WHO's work on multi-stakeholder engagement for the prevention and control of non-communicable diseases, World Health Assembly Decision WHA 74 in brackets 20 on the global health sector strategies on respectively HIV, viral hepatitis, and sexually transmitted infection, an Executive Board Decision EB 146 in brackets 14 on accelerating action to reduce the harmful use of alcohol. Additionally, discussions related to the items on sustainable financing relating to Executive Board Decision EB 148 in brackets 2 were conducted and concluded separately. There are therefore 3 remaining items. For the following 2 items, World Health Assembly Resolution WHA 73.5 on strengthening efforts on food safety and World Health Assembly Decision WHA 74 in brackets 10 on follow-up of the political declaration of the 3rd high-level meeting of the General Assembly on the prevention and control of non-communicable diseases, Member States may provide inputs by contacting the respective WHO Global Focal Point as identified in Section 3 of document WPR/RC72/9 or by email to wprorcm@who.int. Comments provided during the Regional Committee meeting will be collated and submitted to the relevant Global Focal Point. For the last item, World Health Assembly Resolution WHA 74.3 on the Programme Budget 2022-2023, I will seek the Chair's agreement for Mr. Imre Olo, Director of Planning, Resource Coordination and Performance Monitoring from Headquarters, to provide a brief presentation to inform Member States more about this item. With your agreement, Mr. Chair, I now invite Mr. Holo to deliver his presentation. Imre, thank you for joining us so early in the morning. Over to you.
Thank you very much, Corinne. Mr. Vice Chair, honorable delegates, dear Regional Director, if I may ask our colleagues to show the presentation. Thank you. So this is just an update on where we are with the revision of the program budget 22-23. Next slide, please. As you recall, when we presented the program budget this May in 21 to the World Health Assembly, this was exactly the same time that the recommendations of the IPPPR and the other panels were coming in. And we signaled already at the time of presenting the program budget that we are going to review these recommendations. And if needed, we will come back the next year in 22 May with a potential revision of the program budget 22-23 to reflect the recommendations of these numerous panels, and then you can see, and these are probably not even all the panel recommendations that we have in front of us. Next slide, please. I just would like to remind you also that the program budget had 4 strategic focus. One was rethinking preparedness, readiness, and bolstering capacities to health emergencies. The other focus was to build resilience through primary health care and strengthen the nexus between health systems and health emergencies. The third focus was to advance WHO's leadership in science and data. And then the fourth was to get back on track and accelerate achievements towards the SDG goals, which obviously after COVID-19 are falling behind. We believe after considerations of the different recommendations and also the lessons learned from COVID-19, that these 4 strategic priorities still hold. So we're not expecting to change, even if there's a program budget revision, to change the focus of these elements. So the revision, if it happens, it would be activities and elements which fall under these major 4 areas. Next, please. So the recommendations, as we had said, and at that time we were not aware of that when we were presenting the program budget. There are 286 recommendations which have come from these different panels, and 27% of them are directed to WHO Secretariat in different thematic areas. And I would like to call your attention to the fact that the Secretariat has done a compilation of all these recommendations that you can find on WHO's website, and it's been currently being updated as we go along. These are what you can see here are the 10 most common thematic areas which are covered by these recommendations. They go about IHR implementation, strengthening direction coordination in health, including WHO Secretariat's role, global health architecture, governance, global finance, policies, norms, R&D, WHO financing, what we just discussed. It was one of the recommendations also of these 286 recommendations that you had just been discussing. Equitable access to healthcare services, including vaccines and non-pharmaceutical measures, early warning and surveillance, and capacity building and assessment. Next, please. So what we see is that, and what is emerging from this analysis, that these are the areas where we potentially need to strengthen the program budget and the Secretariat's work. And they relate to global health architecture, stronger WHO supported by sustainable financing, IHR implementation, global financing of public common goods, R&D regulations, manufacturing, equitable access to healthcare services, and One Health. So we're currently analyzing this, but these are the main themes where we think a potential program budget revision will fall. Next slide, please. Just to remind you also that when the program budget was was approved, we did receive a 16% increase of the base segment, which moved or increased from basically $3.8 billion to $4.3 billion in 22-23. And what we're really looking at the moment, and working very closely together with the regional offices and the countries, is that the recommendations, how much of these recommendations are already reflected, or how many of these recommendations or the aspects of these recommendations are already reflected in the program budget that we had proposed, what is not reflected, and if it's not reflected, can it be accommodated within the program budget or not? And if not, then what would be the increase that this would entail? And of course, we're also very carefully looking at the feasibility of this, because we are aware that we will only have a year and a half to implement these increases if and when approved. Next, please. The scope of the budget revision would be the short and medium-term implications of those recommendations that were not part of the originally submitted program budget. They would focus on the needed foundational actions for longer-term implications. We would also look at all the resolutions from the 74th Health Assembly that have direct implications on our work. And then, as you know, there are some new initiatives that were not fully reflected in the program budget. For example, the establishment of the Berlin hub that may need to be better reflected in the budget. Next, please. So how much money are we talking about, or how much budget, to be more precise, we're talking about? The starting point for the budget revision is the resolution WHA 74.7, which was about strengthening WHO's preparedness and response, which was adopted at the World Health Assembly. And that, as every other resolution, that had a costing attached to that, which amounts to $435 million. And the costing of this resolution covers the estimated costs primarily under Billion 2 and some on the strategic priority 4, which could be determined at the stage, which we saw already at that stage with some certainty. We also know that strengthening WHO's response is not only Billion 2, there are very strong interlinkages between Billion 1 and Billion 3. And currently we're also looking at what will be the implications of an increase on Billion 1 and Billion 3. But we are basically treating this 435 million as the starting point for that discussion. Next slide, please. So I know that you would have expected much more concrete proposal at this stage, being so close to the January Executive Board. But I think that you can see that with all these recommendations and with all the discussions ongoing, for example, in both working groups and also in the upcoming World Health Assembly, the timing is very tricky, and there are many moving parts to be able to dial in exactly what is needed and what are the budgetary implications of that. We're currently working very closely with our colleagues across WHO to bring that together, have a strategic discussion with the Global Policy Group about the way forward. And the moment we have a more concrete proposal for the budget increase, we're going to use all the channels of informal and formal consultations leading up to the January Executive Board to make sure that your views are heard and that you are informed about the thinking and the concrete proposals that we're going to put forward. Many thanks and for your attention. Thank you.
Thank you. Thank you. We will now hear from member states who wish to speak on this item or ask questions to Mr. Holo. Please indicate your wish to speak by clicking the button on your microphone if you are in the plenary or using the raise hand function on Zoom. I see none. Thank you, Dr. Capuano and Mr. Holo. That concludes our consideration of item of 15.2 and 15.3. Thank you very much. Ministers, let's move to item 15, which is coordination of the works of the World Health Assembly, the Executive Boards, and the Regional Committee. Reference documents WPR/RC72/9. We will now continue with the other part of the agenda, item 15, specifically item 5.1, agenda for 73rd sessions of Regional Committee in 2022. Documents WPR/RC72/9. May I request the Director for Program Management to introduce agenda item 15.1.
Thank you, Mr. Vice Chairperson, distinguished representatives. In continuation of discussion of the coordination of the work of the World Health Assembly, the Executive Board and the Regional Committee, I would like to now refer to Section 1 of Working Document WPR/RC72/9 on the agenda for the 73rd session of the Regional Committee. For the past 5 years, we have used a revised approach to the development of the Regional Committee agenda, whereby we start the process of identifying the main technical agenda items through holding a discussion on possible items at the Regional Committee the year before. This year, we are proposing 7 technical items for the next year's Regional Committee agenda. These items are non-communicable diseases, prevention and control, cervical cancer, communication for health, panel discussion, mental health, policy and governance of medical products, primary health care, reaching the unreached. Member States are also invited to share other proposed technical items in consideration for next year. The Regional Committee agenda typically can accommodate about 5 technical items. These are in addition to progress reports and budget and management agenda items such as this one. With input from today's discussion, the Secretariat will prepare a draft provisional agenda. In January, the Regional Director will informally discuss this draft with the region's Executive Board member. The draft provisional agenda will then be sent to all Member States for comments during the first quarter of 2022. Thank you, Mr. Vice Chairperson.
Thank you, DPM Dr. Capuano. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the big button on your microphone, or if you are in the plenary. For those virtual delegations, raise your hand on the functions, on the Zoom functions. I see Japan. Japan, the floor is yours.
Good morning, and thank you very much, Chair, for giving us the floor. I think 7 proposed items are all important and interesting. So I have no problem to choose either of them, but DPM says that maximally 5 if I'm correct, to need to be prioritized for the next RCM. For me, I heard that a lot of momentum in PHC, and also under COVID, I think unleashed population is important. So I would place PHC and unleashed a priority. And also, momentum is on for NCD, because we heard many times from Ireland member states that NCD is an important subject. So I think I would support NCD as well. From Japanese viewpoints, there is some issue of how to ensure access to essential commodities, such as vaccines. So for me, I think medical products, I think harmonization of regulation is also important subject. Others rest, I'm personally interested in mental health and other items, but that is matter of when to be discussed. For next year, my priority is, as I said. Thank you very much.
I can see Australia. Australia, the floor is yours.
Thank you very much, Vice Chair, and I wanted to thank the Secretary for bringing forward such good suggestions for the agenda for the next RCM. I think all the items that have been flagged are really worthwhile items, and like my colleague from Japan, we'd be very happy to support each one of them. As in terms of priority setting, I think from Australia's perspective, we have a particular interest in discussion on cervical cancer and making sure that remains on the agenda. We've heard in consultation with many of our colleagues across the region, particularly across the Pacific, of the importance of this issue, and we'd be very enthused to see that remain on the agenda as one of the key priorities. But as I said before, we support all the agenda items that are proposed. Thank you very much.
Thank you, Australia. Are there any more representatives wishes to speak on this topic? I see none. May I now call the Secretary to respond to the points that have been made?
Thank you, Vice Chairperson and distinguished representative. Thank you for your input on the proposed provisional agenda items. The goal of WHO is to ensure that our efforts are focused on Member States' needs and priorities. And according to your comments, all the proposed items are of interest to the committee. So, as mentioned earlier, the Secretariat will prepare a draft provisional agenda with input from the comments of today. That document will be informally shared with the region's executive board members in January 2022, and then will be sent to Member States for comment. Thank you, Mr. Vice Chairperson.
Thank you. Ministers, representatives, that concludes our consideration of this item, of these agenda items, and thank you very much. May I remind the committee, after the coffee break, we will take up the proposed resolutions and decisions. Ministers, representatives, similar to the previous sessions, we will still have our mobility break. Calisthenics, which should be very familiar to our Japanese colleagues. It was created as a form of exercise that is easy enough for anyone to do. In this modern form, it is practiced by local communities all over the country. May I ask everyone to please stand up, switch your camera on, and join in. For those in the plenary, may we request everyone to maintain safe distance. Thank you. Ministers, delegates, the tea break will be for 40 minutes. We will be back at about 11:15. Thank you.
Health is important because it helps my body to function.
Recording stopped.
Being hurt. Nobody likes being injured.
I can go to school every day and do all my classwork smoothly.
I can feel happy as I enjoy myself playing around with my friends and siblings.
It gives you strength and a better immune system.
So I can grow strong and healthy like mom and dad.
Health to me is healthy eating and eating the correct portion sizes.
Because we only have one life and we have to take care of it very well.
Try to stay healthy always from viruses and other sicknesses.
It means we have the ability to help our community and the people around us.
Why is health important to my future? So I can grow up free from being sick.
Also being mentally healthy, like being happy.
I can do my responsibilities and enjoy my time with other people.
I can continue my education in the overseas and to reach my goal as I want to be a doctor.
I can do and think of good things and reach my goals for my future.
It's also about being in a good and safe environment.
And to help protect the planet's future and the generations after me.
If I take care of my health well, I will be able to enjoy my future.
Longer life equals more time spent with your family and loved ones.
Because when we eat vegetables, we became strong. You'll be more stronger than the bad guys, and then the bad guys will be scared.
Анхны үүрэг гүйцэтгэх хугацаанд би өөрийн гар дээр эмийг алдлаа. Анх прохтой ганц ангил гэдэг цэргийн төвөмлөгийн эрчим тэмцэлгээний ихэмж дэслэг цалтай. Манай эмээ тийм биеийн байдал жоохон доктортой гайгүй байх үедээ би сайн байна. Одоо гэртээ гарна. Миний хөө мундаг сайн ажиллаж ийнэ гэж амьдралынхаа эцсийн мөч хүртэл бас тэмцэжсэн явдал доорлоод татсан санагддаг та. Саяны сүүлийн үүрэг гүйцэтгэлээр нэг өдрийн дотор нэг цагийн дотор 3 хүнээс иржсэн тохиолдол гарсан. Бид бүхний нүдэнд бол тэр 3 хүний ар гэрийнх нь үр хүүхдүүд нь ач зээнэр нь л ер нь бидний нүдэнд харагддаг. Яаж ар гэрт нь одоо биеийн байдал нь ийм байсан, одоо ийм болоод өнгөрчлөө гэдэг юм уу, тэр талаар мэдээлэл дуулах их хэцүү. Тэгээд одоо үүрэг гүйцэтгэж явах үедээ тэр нь бол одоо миний эмээгээс өрцөхгүй, миний өвөөгөөс өрцөхгүй гэж ер нь бол миний ойр дотны хүн шиг л одоо бүх хүмүүс харагддаг учраас тэдний хайнасыг нь аврахын тулд бид бүхэн ер нь өдөр шөнөг бол өөрийгөө гүйцэтгээд өргөсөн тагарахтай хэмжээг зүтгэж явж байна. Хүмүүсийн ер нь биеийн байдал сайжраад эмнэлгээс гараад хөл дээрээ босоод гарч ирсэн тохиолдол бол зөндөө байгаа. Тэр хүмүүсийн гарахтаа баярлалаа гэж хэлж байгаа үг нь л ер нь одоо л миний сэтгэл санаанд их тод идэг. Дуртай газар гэх юм бол зайсан толгой дээр нар жаргах цагаар гарч хотын байдлыг харах. Зайсан толгой дээр гараад зогсоход нэг сэтгэл уужраад уушиг тэлэгдээд ингээл дотроосоо их тайвширлыг л мэдэрдэг. Хөл хорооны байдалтай холбоотойгоор л манай найзууд сүүлийн хэдэн сар ер нь бол уулзлах байгаа. Тэгээ бид бүхэн одоо хоорондоо таарах магадлал хомс ер нь бол байхгүй болсон. Тэгээ одоогоор ингээд 100 гаруй насаар л ингээд гарчаад байгаа. Энэ чигээр ингээд энэ тоон дээр ингээд бариад ингээд зогсоохын тулд ард иргэд хүн бүхэн мэргэжлийн байгууллагаас гарч байгаа тэр заавар зөвлөмж гэдэг юм л заашгүй биелүүлэх шаардлагатай байна. Энэ вакцин гэдэг зүйлтэй хүн болгон л идэвхтэй хамрахад бас айлгаж өсөж байна.
Gulat kami bakit nauso dito yung tigdas dito sa amin. Nag-umpisa po noon sa taas po namin nakatira. Tapos po sa katabi rin po namin nagkatigdas. Tapos yung anak ko pong 3, ayun po, kawawa na po. Bali, ang pamilya ko po malaki, marami po akong anak. Yung anak ko po, 7, anak ko po, yung mga kumpleto po bakuna. Bali, 3 lang po. Ayun, hindi na po napabakunahan. Yung 3 po, yun. Yun talaga po yung mga nagkatigdas. Nung balik po nung kasama po yung tatay ko, ayun po, medyo nakakaliwa kasi nakapaghanap buhay po ako. Balik tatay ko, nagbabantay. Ito lang talaga na wala lang din yung tatay ko. Wala magbabantay sa mga anak ko. Ayun lang po, di na ako nakapagpadala sa center. 9 months po yung baby ko. Tapos sumunod po, 3 years old, tsaka 4 years old po. Nung nagkatigdas po. Una nilalagdas, may ubo po. Tapos nakita ko po may pamumula na po sa katawan nila. Mga ilang araw, naging itim na. Kasi dumami na sila ng dumami. Lagnat lang po talaga yung binabantayan ko kasi yung pinakakatakot. Yung mag-convulsion, sabay-sabay po sila, 3. Doon po ako natatakot kasi umiyak lang. Hindi ko alam kung ano yung nararamdaman po nila. Kaya natatakot ako. Anong masakit sa nila, tanong ko ng gano'n. Wala, iyak ko lang. Naawa po yung mga kapatid niya po. Sabi nga ng anak ko po, ba't di pa dali sa ospital? Kasi nga yung natakot nga rin anak ko po. Sabi ko, paano ko dadalhin? Wala magbabantay sa ibang kapatid mo. Pumayat po talaga sila, natuyot yung balat, halos ayaw kumain. Sabi ko, kung pwede lang, balikan talaga. Sisisirin din po kasi ako nun. Kung napabakuna ako po talaga, hindi sana magkakagaling ng anak ko. Nakayanan din po sa awa po ng Diyos. Siguro po mga 5 araw, 4 na araw yun, nakakain na po sila. Okay na po sila. Normal na po. Yung panganay po na apo ko po, ayun, kompleto rin po bakunan. Talagang pinaano ko sa anak ko na pabakunahan niya yan. Libre naman yun, wala namang bayad. Bakit di ka magpabakuna? Sabi ko sa anak ko. Ang sasabihin ko lang po sa kanila na hanggat maaga, pabakunahan mo yung anak mo. Ito kong anak, hindi nagkatigdas. Tapos yung 3 nagkatigdas. Mahalaga po talaga yung bakuna. Wag po silang tamarin. Para sinasabi po nilang di totoo yan. Totoo po talaga yung bakuna po.
1月23号武汉封城大家都没有任何的准备，那明显的大家就一定会产生各种各样的心理的上面的问题。平时呢，我是一名普通的心理工作者，在疫情期间呢，那我担任了很多的心理援助的工作。刚开始的时候，电话其实上是蛮多的。在疫情期间找我来做心理咨询，其实上基本上都是以焦虑为主的。比如说，我就拿普通的民众来讲哈，对吧？我的存款能撑多久？我会不会被感染？喂。哎，听得到。我接到一位医护可能压力比较大就在电话那头哭。 你想想，穿上那么厚的防护服进去几个小时不吃不喝，面对生死面对病人的生死，以及面对被感染的风险，我们沉默了很长一段时间。那我们会更多的是倾听。其实他只要能够感受到我不是孤单的，他就能够有信心走下去。疫情期间的心理援助工作，除了线上的这个咨询以外，还要到方舱医院和隔离点里面去做面对面的直接的这种援助。那天第一次进隔离点真的很害怕，刺鼻的这种消毒水的味道每一位小哥哥小姐姐都戴着口罩和眼镜，分不出来谁是谁。我第一个来访者有一个婆婆她就拉着我的手，然后特别多想要跟我讲的。她已经好长时间没回家了然后她已经70多岁了没有人可以跟她有过多的交流她那一下握着我的手特别的就是给我的感觉就是眼泪都要流出来了，所以才让我觉得这样一份工作非常的有意义。封城这么久70、80天我自己也有想发疯的时候一天又过了一天，然后在这个过程当中也特别的难熬特别是我的工作接触到大量的负面的能量，那我就会找我的心理老师我可能约他的时间打个电话聊一下。经过这次疫情之后，普通民众的心理一定是有非常大的变化的，不管他是直接面对还是间接的这种面对但是他都是身处这个感受其中的。我们心理老师是那一点光希望这一点光慢慢和大家一起汇成巨大的一束光束，能够给处在这样一次疫情的人们当中给你们带来一些我们能够做的温暖。
When I had my really bad attack in March, the thought that was running through my mind, because Mary was out, was I don't want to die alone. Now I've got all emotional again. Okay, sure. I live in a Melbourne suburb called Coburg, and I live with my wife, Mary. About 10 years ago, I started getting urinary tract infections. Pain in the bladder, burning sensation when peeing. Initially they responded to very common antibiotics. Then as years went by, I would continue to get urinary tract infections and we'd have to change the antibiotics. The ones I was on weren't working because the bacteria that I had became resistant. In March this year, I had a really scary occurrence. I started getting cold and I started shaking uncontrollably. Mary was out and I phoned her up and I said, "You got to come home. I'm really ill." She took me down to the emergency department of Royal Melbourne Hospital where I was immediately admitted. I was thinking I was going to die. I was in hospital for a week and I had what's a central line put in where they put a tube into your arm which wiggles up here down to the heart and put onto some of these so-called last resort antibiotics. And I had my last dose 4 weeks ago yesterday and miraculous, well, it seems miraculous to me, I've been infection-free for 4 weeks. Touch wood. It's emotionally draining. There's something lurking in the back of your mind about what happens when the next one comes. It's affected the last 10 years. My hopes for the future, no more infections. Need to be cautioned as often as possible about the importance of simple hygiene. Don't believe that antibiotics are going to solve sniffles and coughs and colds, because they're not, because mostly antibiotics don't work against viruses. Make sure that you finish them. Don't just take them till you feel good and then say, I don't need to take it anymore. Finish the course. Antibiotics have saved millions of lives, including mine. But there's a danger because of resistance that we're going to lose that. Is our luck going to hold out forever? I don't know.
Greatest dream blow me dream blow one day me reaching Olympic Games. All best no more, all by all champions no more, only play lo games. And me reaching dream blow me and me glad. Time me stop overseas and Vanuatu fly, can me fly on top. Tears blow me master. From one and from me proud said, me stop represent them. All people blow me feel him one very good feeling. Me Annalyn, me play table tennis. Me represent Vanuatu, lo sport now. Me grow up lo island. Also man pikinini, me grow up. Kakai island kakai. You kakai Navara, you kakai Navel, you kakai something fruits. And me go lo Karen, walk lo Karen. Time me come lo town. You look life one life where it different all geta. Main thing now you start looking non-communicable diseases, me big one lo Pacific, and you me lo Vanuatu. Full up man only stop death lo sikia. So suppose you got one active life also. You move plant days, you sweat out, but you feeling me good and me want something where I me make him blow you no save kasim sikia. Anyone is have a play sports. From everyone you can right to play sports. Me no save do him one way me do him today. Sports me no got support lo family. Vanuatu, especially also one woman, okata blow house, okata blow kitchen, blow cook, blow wash, look out and pikinini. But now blow me very important lo me. He mi save support me lo day one kasem now ya. Him look out and pikinini, make him say me save continue blow make him one way me love him. Me one mama blow 2 boys and I'm already 42. Me still feel very strong. Sport him also one medicine blow body from me. It make me stop fit all time. Mentally too, me feel him and me helping me build him confidence. Now yeah, me have started on one business plan me lo side lo fitness industry and me want something where me never think about me make him same full up mama lo Vanuatu only no exercise. Me go gym me no look one mama and me want fitness exercise and me Zumba and me put them out all mama only come. We like exercise and then only like it. Ikat sambala we first time only come, only sakat knee pain, only sakat back pain, so only come try mo. And me ask him all get how only feel, only say knee so he loose, back pain he loose, only feel more relaxed, only feeling good. That's why I only come every time. Me want them continue blow me stop healthy. Continue to make an exercise as long as me still alive and well. Me continue to live healthy lifestyle.
Today是他感染的第3天。大家好，我是海棠，一名饮食摄影师。我老婆叫李婷。一名医院急诊科的护士，我希望通过这个视频来记录我们抗击肺炎的点点滴滴。每次全副武装进入他的房间，刚凉了，凉烧没有？生病了。家里的每一个地方也都要消毒，让病毒无处可跑。该吃的吃的，做好他爱吃的每一个菜，补充营养，希望他有充沛的体力去打败病毒。 事，我就在里头了，不出去了。
我不要你在里面。
不然。所以我们准备今天去医院复查。怎么样，老师？他有问题吧？
老师怎么样了？好像有问题。
还是有问题的。医生说 CT 片子上面显示感染有加重，住院治疗是我们现在最好的选择了。
我觉得我的身体太大了，我觉得身体都太大了。
老婆，你后不后悔跟我结婚？
不后悔，我一点都不后悔。
你后悔？
我不后悔，我一点都不后悔，真的。我很幸福啊。
你后悔？你后悔？
我真不后悔，我后悔没有早点认识你。我和儿子在等着他的痊愈。我老婆明天终于要出院了，然后我现在特别兴奋，真的是很开心，就是太开心了，太煎熬了，真的是太煎熬了。然后这段时间我感觉所有的努力也没有白费，然后终于快熬到了这一天了，真的是太开心了，很开心现在。
哎呀，亲一口爸爸，亲一口爸爸。
你赶快给你。这段生死的历程，在我们的生命里刻下了一道深刻的印记。未来，我希望我们都能好好的。我希望石头长大了，能记住这一年，记住他的妈妈受过的苦难，记住那些为疫情付出的人们。你现在身体怎么样？
好得很呢，不然你为什么要我做卫生呢？一回来就。
我没有要你做卫生，是你自己回来，这里要搞那里要搞。
Now talking me or say I'm got the poli. I'm no papa. Baby, I'm no son up, sit down, kayetu. I'm just have 6 months or 5 months kind of. I'll see Kim with Lagoya, every Wednesday with Lagoya. Also, talking me low, Avinu me mas boiling water, morning, Avinu me boiling now. Put it leg, block him, na pulling, molig, leg, can, finger, stretching, most now. Body road. Okay, now all family will start on the flyer. All for it, all become inside the area. All become inside, it sit down. Me worry, me since to blessing, me cry. Moklo pray lo papa God lamp helping me. Then si picking in blend or carry me go. Bang for suicide, most to car. Me less the ember kissing. This last sick cripple never stop on me because me no carry him this like I'm picking me. Walk the boiling water, woman hand blame, leg blogger. Making me go na, a moklo crawl or some baby. Crawl ligo. Me tired and you exercise me. So night me plan to actually, me last exercise me. Ego. And start emiet them crawl wrong. Me moklo pray lo God that's all me continue me pray here. Big man help this la pikinini. Stand up inside the house meet the sister of me la stand up and holy hand like me. And walk about the go. Na me talk thank you na me big mouth na me cry. Toko sa mi mama blog gafo. Mi toko sem. Avel dol mas kisim this la drop. I'm no kisim so I'm kisim this la sick. I'm man blogo. I'm sa helping me. I'm baka sit down helping me. When them leave work, me came must come helping me, but I'm cleaning sweat, do me. Me name's helping me.
あの時私は孤独でした。高校時代の私は自ら命を絶つことも考え、一人苦しんでいました。後に私は信頼できる恩師に奇跡的に出会えたことで問題を乗り越えられました。問題を抱えた人が奇跡や運や偶然でしか僕にとっての先生のような頼れる人と出会えないというそういう環境はおかしい。問題を抱えた人が確実に頼れる人にアクセスできるような仕組みを作り、望まない孤独を抱えることがないように我々はあなたの居場所というのを立ち上げました。あなたの居場所は24時間365日誰でも無料匿名で利用できるチャット相談の窓口になります。私たちにアクセスをしてくださる方のほとんどが29歳以下の子供や若者たちになります。メンタルヘルスに悩む多くの人に共通している課題は孤独を抱えているということです。友達や家族は近くにいるけど相談できない、頼りたくても頼れないという状況にあります。私たちのミッションはこうした状況をなくすこと、つまり望まない孤独をなくすということになります。私たちはまずは話を聞いて、そして自分の気持ちに寄り添ってもらえる場所がある、自分は一人ではないというふうに感じてもらうことが大切だというふうに考えています。間違いなくこのコロナによって人々のメンタルヘルスというのは大きな影響を受けたと思います。実際にデータを見てみると顕著で、特に子供や若者、そして女性が影響を受けています。ただ、パンデミックによってメンタルヘルスに対する考え方というのは大きく変わったと思います。例えば、このパンデミックの中で、多くの人がメンタルヘルスの問題を抱えているということは、社会に広く知られるようになってきました。僕自身はやっぱり望まない孤独をなくしたいと思って今この活動をしていて、相談師さんと日々接している中でその相談師さんが抱える本当に苦しみというのがよくわかるんですよね。自分自身もそうだったので、孤独対策をやろうと言って少しずつ社会が動いてきたと思います。若者が自分の言いたいこととかやりたいことを言ったとしてもそれが認められないっていうふうに言われてますけど、しっかり理由があって、そしてどういう社会を築いていきたいのかっていうビジョンを示すことができれば、学生であっても若者であっても、少しずつかもしれないけれども社会を動かしていけるというのはこの経験から学んだことですね。
เราต้องเตรียมพร้อมบ่ว่าจะเป็นตอนสายตอนเช้าตอนสายหรือว่าตอนกลางคืนเนาะสำหรับสุขศาลาเฮาแม่นก็แม่นอยู่เขตห่างไกลเนาะถ้าว่ามีคนเจ็บมาก็พร้อมที่ว่าจะช่วยเขาเจ้าเฮาเฮ็ดเวียกอยู่กับชุมชนมันจะมีความสุขแล้วก็มีความภูมิใจหลายกว่าอันถ้ามารู้สึกเมื่อยบ่ก็บางครั้งก็เมื่อยเนาะแต่ว่าเฮาเฮ็ดไปแล้วที่ว่าเฮาซอยไปแล้วเนาะเห็นเด็กน้อยกับแม่แข็งแรงคือว่ามีความสุขแล้วลืมเบิดเลยมีกรณีนึงเนาะที่ว่ามาเกิดลูกเนาะในเบื้องต้นที่ว่าปกติทุกอย่างเนาะหลังจากเล็กออกแล้ววันนี้แฮบ่โคเนาะแฮบ่โคแล้วเฮาก็เฮ็ดนวดมดลูกแล้วแต่ว่าแฮก็ยังบ่โคแล้วเฮาก็รู้สึกทั้งย้านแล้วก็ประสบการณ์เฮาก็แบบว่า บ่เคยเจอสักเทื่อเนาะจากสุขศาลาเฮาไปหาห้องหมอก็60 กว่ากิโลสำหรับสุขศาลาเฮามันบ่มีเนาะมีแต่เดี๋ยวนี้มีแต่อันคืออ้ายมันเป็นอันเจ้าพยาบาลคือน้องพะโรงคันมี2 คนเลยแล้วก็ทางญาติแน่แต่ว่าก็พยายามเฮ็ดสุดความสามารถได้อันใส่ถุงมือยาวเพราะว่าจกเอาแฮออกแล้วหลังจากเฮาปฏิบัติแนวนั้นแล้วก็แม่ก็ปลอดภัยถ้าว่าบ่มาเกิดอยู่สุขศาลาก็คิดว่าน่าจะบ่รอดเนาะรู้สึกภูมิใจที่สุดด้วยความรู้สึกของเฮาณตอนนั้นน่ะก็คือว่าเฮาช่วยชีวิตคนคนหนึงได้เนาะแล้วเฮาก็สิพยายามแบบช่วยต่อไปเรื่อยๆย้อนว่าเฮาลงไปเนาะมักที่สุดเลยเขาแบบมันแบบว่าถือเป็นกันเองเนาะคือแบบคนในครอบครัวกล้าเว้ากล้าว่ากล้าปรึกษาคือว่าตัดสินใจแล้วว่าจะเฮ็ดเวียกอยู่นำชุมชนตลอดไป
Healthy, like being happy.
I can do my responsibilities and enjoy my time with other people.
I can continue my education in overseas.
Recording in progress.
My goal as I want to be a doctor.
I can do and think of good things and reach my goals for my future.
It's also about being in a good and safe environment.
And to help protect the planet's future and the generations after me.
If I take care of my health well, I will be able to enjoy my future.
Longer life equals more time spent with your family and loved ones.
Because when we eat vegetables, we became strong. You'll be more stronger than the bad guys, and then the bad guys will be scared.
Анхны үүрэг гүйцэтгэх хугацаанд би өөрийн гар дээр эмээг алдлаа. Анх прогтой ганц ангил гэдэг цэргийн төвөмлөгийн эрчим тэмцэлгээний ихэмж дэслэг цалтай. Манай эмээ тийм биеийн байдал нь жоохон доктортой гайгүй байх үедээ би сайн байна. Одоо гэртээ гарна. Миний хөө мундаг сайн ажиллаж ийнэ гэж амьдралынхаа эцсийн мөч хүртэл бас тэмцэжсэн явдал доорлоод татсан санагддаг. Саяны сүүлийн үүрэг гүйцэтгэлээр нэг өдрийн дотор нэг цагийн дотор 3 хүнээс ирж исэн тохиолдол гарсан. Бид бүхний нүдэнд бол тэр 3 хүний ар гэрийнхэн бүр хүүхдүүд нь ач зээнэр нь л ер нь бидний нүдэнд их харагддаг. Яаж ар гэрт надад би юм байдал нь ийм байсан, одоо ийм болоод өнгөрчлөө гэдэг юм уу, тэр талаар мэдээлэл дуулах их хэцүү. Тэгээд одоо үүрэг гүйцэтгэж явах үедээ тэр нь бол одоо миний эмээгээс өрцөхгүй, миний өвөөгөөс өрцөхгүй гэж ер нь бол миний ойр дотны хүн шиг л одоо бүх хүмүүс харагддаг учраас тэдний хаймнасыг нь аврахын тулд бид бүхэн ер нь өдөр шөнөг бол өөрийгөө гүйцэтгээд өргөсөн тагарахтай хүнчээр зүтгэж явж та. Хүмүүсийн ер нь биеийн байдал сайжраад эмнэлгээс гараад хөл дээрээ бусаад гарч исэн тохиолдолд бол зөндөө байгаа. Тэр хүмүүсийн гарахтаа баярлаа гэж хэлж байгаа үг нь ер нь одоо л миний сэтгэл санаанд их тод идэг. Дуртай газар их юм бол зайсан толгой дээр нар жаргах цагаар гарч хотын байдлыг харах. Зайсан толгой дээр гараад зогсоход нэг сэтгэл уужраад уушиг тэлэгдээд или дотроосоо их тайвширлыг илмэрдэг. Хөл хорооны байдалтай холбоотойгоор л манай найзууд сүүлийн хэдэн сар ер нь уулзлага байгаа. Тэгээд бид бүхэн одоо хоорондоо таарах магадлал хомс ер нь бол байхгүй болсон. Тэгээ одоогоор ингээд 100 гаруй насаар л ингээд гарчаад байгаа. Энэ чигээр ингээд энэ тоон дээр ингээд бариад ингээд зогсоохын тулд ард иргэд хүн бүхэн мэргэжлийн байгууллагаас гарч байгаа тэр заавар зөвлөмж гэдэг юм л зайлшгүй биелүүлэх шаардлагатай байна. Энэ вакцин гэдэг зүйлтэй хүн болгон л идэвхтэй хамгаалалтаа сайн гэж хүсэж байна.
Gulat kami bakit nauso dito yung tigdas dito sa amin. Nag-umpisa po noon sa taas po namin nakatira. Tapos po sa katabi rin po namin nagkatigdas. Tapos yung anak ko pong 3, ayun po, kawawa na po. Bali, ang pamilya ko po malaki, marami po akong anak. Yung anak ko po, 7, anak ko po, yung mga kumpleto po bakuna nun. Bali, 3 lang po. Ayun, hindi na po napabakunahan. Yung 3 po, yun. Yun talaga po yung mga nagkatigdas. Nung balik po nung kasama po yung tatay ko, ayun po, medyo nakakaliwa kasi nakapaghanap buhay po ako. Bali, tatay ko nagbabantay. Ito lang talaga na wala lang din yung tatay ko. Wala magbabantay sa mga anak ko. Ayun lang po, di na ako nakapagpadala sa center. 9 months po yung baby ko. Tapos sumunod po, 3 years old, tsaka 4 years old po. Nung nagkatigdas po. Una nilalagdas, may ubo po. Tapos nakita ko po may pamumula na po sa katawan nila. Mga ilang araw, naging itim na. Kasi dumami na sila ng dumami. Lagnat lang po talaga yung binabantayan ko kasi yung pinakakatakot. Yung mag-convulsion, sabay-sabay po sila, 3. Doon po ako natatakot kasi umiyak lang. Hindi ko alam kung ano yung nararamdaman po nila. Kaya natatakot ako. Anong masakit sa'yo? Natanong ko ng gano'n. Wala, iyak lang. Naawa po yung mga kapatid niya po. Sabi nga ng anak ko po, ba't di pa dali sa ospital? Kasi nga yung natakot nga rin anak ko po. Sabi ko, paano ko dadalhin? Walang magbabantay sa ibang kapatid mo. Pumayat po talaga sila, natuyot yung balat, halos ayaw kumain. Sabi ko, kung pwede lang, balikan talaga. Sisisi rin din po kasi ako nun. Kung napabakuna ako po talaga, hindi sana magkakagal yung anak ko. Nakayanan din po sa awa po ng Diyos. Siguro pa mga 5 araw, 4 na araw yun, nakakain na po sila. Okay na po sila. Normal na po. Yung panganay po na apo ko po, ayun, kompleto rin po bakunan. Talagang pinaano ko sa anak ko na pabakunahan niya yan. Libre naman yan, wala namang bayad. Bakit di ka magpabakuna? Sabi ko sa anak ko. Ang sasabihin ko lang po sa kanila na hanggat maaga, pabakunahan mo yung anak mo. Ito kong anak hindi nagkatigdas. Tapos yung 3 nagkatigdas. Mahalaga po talaga yung bakuna. Wag po silang tamarin. Parang sinasabi po nilang di totoo yan. Totoo po talaga yung bakuna po.
1月23号武汉封城大家都没有任何的准备，那明显的大家就一定会产生各种各样的心理的上面的问题。 平时呢，我是一名普通的心理工作者。在疫情期间呢，那我担任了很多的心理援助的工作。刚开始的时候，电话其实上是蛮多的。在疫情期间找我来做心理咨询，其实上基本上都是以焦虑为主的。比如说，我就拿普通的民众来讲哈，对吧？我的存款能撑多久？我会不会被感染？喂，哎，听得到？我接到一位医护可能压力比较大就在电话那头哭。你想想，穿上那么厚的防护服进去几个小时不吃不喝，面对生死面对病人的生死，以及面对被感染的风险，我们沉默了很长一段时间。那我们会更多的是倾听。其实他只要能够感受到我不是孤单的，他就能够有信心走下去。疫情期间的心理援助工作，除了线上的这个咨询以外，还要到方舱医院和隔离点里面去做面对面的直接的这种援助。那天第一次进隔离点真的很害怕，刺鼻的这种消毒水的味道每一位小哥哥小姐姐都戴着口罩和眼镜，分不出来谁是谁。我第一个来访者有一个婆婆她就拉着我的手，然后特别多想要跟我讲的。她已经好长时间没回家了然后她已经70多岁了没有人可以跟她有过多的交流她那一下握着我的手特别的就是给我的感觉就是眼泪都要流出来了，所以才让我觉得这样一份工作非常的有意义。封城这么久70-80天我自己也有想发疯的时候一天又过了一天，然后在这个过程当中也特别的难熬特别是我的工作接触到大量的负面的能量，那我就会找我的心理老师我可能约他的时间打个电话聊一下。经过这次疫情之后，普通民众的心理一定是有非常大的变化的，不管他是直接面对还是间接的这种面对但是他都是身处这个感受其中的。我们心理老师是那一点光希望这一点光慢慢和大家一起汇成巨大的一束光束，能够给处在这样一次疫情的人们当中给你们带来一些我们能够做的温暖。
When I had my really bad attack in March, the thought that was running through my mind, because Mary was out, was I don't want to die alone. Now I've got all emotional again. Okay, sure. I live in a Melbourne suburb called Coburg, and I live with my wife, Mary. About 10 years ago, I started getting urinary tract infections. Pain in the bladder, burning sensation when peeing. Initially they responded to very common antibiotics. Then as years went by, I would continue to get urinary tract infections and we'd have to change the antibiotics. The ones I was on weren't working because the bacteria that I had became resistant. In March this year, I had a really scary occurrence. I started getting cold and I started shaking uncontrollably. Mary was out and I phoned her up and I said, "You got to come home. I'm really ill." She took me down to the emergency department of Royal Melbourne Hospital where I was immediately admitted. I was thinking I was going to die. I was in hospital for a week and I had what's a central line put in where they put a tube into your arm which wiggles up here down to the heart and put onto some of these so-called last resort antibiotics. And I had my last dose 4 weeks ago yesterday, and miraculous, well, it seems miraculous to me, I've been infection-free for 4 weeks. Touch wood. It's emotionally draining, and there's something lurking in the back of your mind about what happens when the next one comes. It's affected the last 10 years. My hopes for the future, no more infections. Need to be cautioned as often as possible about the importance of simple hygiene. Don't believe that antibiotics are going to solve sniffles and coughs and colds, because they're not, because mostly antibiotics don't work against viruses. Make sure that you finish them. Don't just take them till you feel good and then say, I don't need to take it anymore. Finish the course. Antibiotics have saved millions of lives, including mine. But there's a danger because of resistance that we're going to lose that. Is our luck going to hold out forever? I don't know. I don't know.
Greatest dream blow me dream blow one day me reach Olympic Games. All best no more, all by all champions no more, play lo games. And me reach him dream blow me and me clap. Time me stop overseas and Vanuatu fly, can me fly on top. Tears blow me master. From one and from me proud said, we stop represent them. All people blow me feel him one very good feeling. Nemblo mi Annalyn, me play table tennis. Me represent them Vanuatu, lo sport now. Me grow up lo island. Also man pikinini, me grow up. Kakai island kakai, you kakai navara, you kakai navel, you kakai something fruits. And me go lo karen, walk lo karen. Then me come lo town. You look life one life where it different all kita. Main thing now you start looking non-communicable diseases, me big one lo Pacific, and you me lo Vanuatu. Full up man only stop death lo sikia. So suppose you got one active life also. You move planters, you sweat out, but you feeling me good and me want something where I me make him blow you no save kasim sikia. Anyone is have a play sports. From everyone you got right to play sports. Me no save do him one way me do him today. Sports me no got support lo family. Vanuatu, especially also one woman, okata blow house, okata blow kitchen, blow cook, blow wash, look out and pikinini. But now blow me very important lo me. Him is have support me lo day one kasem now ya. Him look out and pikinini, make him say me have continue blow make him one way me love him. Me one mama blow 2 boys and I'm already 42. Me still feel very strong. Sport him also one medicine blow body from me. It make me stop fetal time. Mentally too, me feel him and me help me build him confidence. Now yeah, me have start him on one business plan. Me lo side lo fitness industry and me want something where me never thinks about me make him same full up mama lo Vanuatu only no exercise. Me go lo gym me no look one mama. And me want fitness exercise and me Zumba and me put him out all mama only come. We like exercise and then only like it. Ikat sambala we first time only come, only sagat knee pain, only sagat back pain, so only come try mo. And me ask him all get how only feel, only say knee so he loose, back pain he loose, only feel more relaxed, only feeling good. That's why I only come every time. Me want them continue blow me stop healthy. Continue to make an exercise as long as me still alive and well. Me continue to live healthy lifestyle.
今天是他感染的第3天。大家好，我是海棠，一名饮食摄影师。我老婆叫李婷。一名医院急诊科的护士，我希望通过这个视频来记录我们抗击肺炎的点点滴滴。
每次
全副武装进入他的房间。刚量了，量烧没有？
有了。
家里的每一个地方也都要消毒，让病毒无处可跑。该吃的吃的。做好他爱吃的每一个菜，补充营养，希望他有充沛的体力去打败病毒。没事的，没事的，我就在里头啊，我不出去了。我不要你在里面。你不哭了啊？所以我们准备今天去医院复查。怎么样，老师？他有问题吧？
老师怎么样了？好像有问题。
还是有问题的。医生说 CT 片子上面显示感染有加重，住院治疗是我们现在最好的选择了。
我觉得我的身体太大了，我觉得自己都太大了。
老婆，你后不后悔跟我结婚？
不后悔，我一点都不后悔。
你后悔？
我不后悔，我一点都不后悔，真的。
Honorable Ministers, welcome back from coffee break. Next on our item is item number 3, which is tuberculosis. The first proposal resolutions WPR/RC72 stroke conference paper number 3 is on traditional and complementary medicines. May I call... My apology. Number 3 is on tuberculosis. May I call on English rapporteur to read the resolutions with amendments from the draft uploaded on the web portal.
Thank you, Mr. Chair. I'm pleased to present the draft resolution on tuberculosis. The French rapporteur and I have made sure that the draft captures the concerns expressed by member states, both in the plenary session and online. So we completed this process yesterday afternoon in the rapporteur's meeting. Since then, we have received no additional requests for amendment. So now I will read the resolution. So WPR/RC72/conference paper number 3, dated 29 October 2021. The Regional Committee, appreciating the commitment and efforts of member states and partners towards reducing the region's tuberculosis, TB, burden and implementing the regional framework for action on implementation of the End-TB strategy in the Western Pacific 2016 to 2020. Recalling the commitments made in the Moscow Declaration to end TB at the first WHO Global Ministerial Conference, Ending TB in the Sustainable Development Era, a multi-sectoral response held in 2017. Recalling also the unprecedented political commitment achieved with the 2018 Political Declaration of the high-level meeting of the UN General Assembly on the fight against tuberculosis, vowing to end the epidemic globally by 2030, stressing that the pace of progress in the Western Pacific region, with a reduction of 6% in TB incidence and 13% in mortality from 2015 to 2020, is too slow to meet the End-TB strategy targets. Deeply concerned about the continued threat of multi-drug resistant TB, catastrophic costs incurred by many TB patients and their families, and low coverage of TB preventive therapy in the Western Pacific region. Noting with concern the adverse effects of the COVID-19 pandemic on TB programs across the region, including the disruption of service delivery and significant reductions in case notification in 2020, as well as potential long-term effects. Recognizing the rapid epidemiological, demographic, and socio-economic transitions happening in most countries in the region, and how these transitions complicate TB care and prevention. Recognizing also that addressing TB care and prevention challenges requires a country-focused approach with multi-sectoral engagement and accountability to address factors within the health sector and beyond. 1. Endorses the Western Pacific Regional Framework to end TB 2021 to 2030. 2. Urges member states, 1. to update national strategies, policies, and plans for tuberculosis care and prevention, guided by the regional framework. 2. To prioritize TB care and prevention, strengthening the system of service delivery using innovation, regular monitoring and targeting vulnerable groups to ensure that efforts reach the unreached. 3. To establish and strengthen multi-sectoral engagement and accountability to address challenges within and beyond the health sector. 3. Request the regional director, 1. to provide technical support to member states in the implementation of the regional framework. 2. To advocate and enhance collaboration and partnership to further strengthen TB programs in the region. And 3. To report periodically on progress in implementing the Western Pacific Regional Framework to end TB 2021 to 2030. Thank you, Mr. Chair.
Thank you. Are there any other proposed amendments? Please indicate your wish to speak by clicking the big button on your microphone if you are in the plenary, or those who are virtual, raise hand function on Zoom. I see none. If there are no further comments, the draft resolutions as amended is adopted. Honourable Ministers, representatives, we are moving to item 16, and that is special programs of research developments and research training in human reproduction. Memberships of the Policies and Coordination Committee, and that is documents WPR/RC 72/10. We now move to agenda item 16, special programs of research developments and research training in human reproduction. And may I request the Director of Program Management to introduce this item.
Thank you, Mr. Chairperson, distinguished representatives. The WHO Special Program of Research, Development and Research Training in Human Reproduction established the Policy and Coordination Committee as its governing body. Presently, the committee has a total of 34 members, including 14 member states elected by WHO regional committees for 3 years term. 3 of these are allocated to the Western Pacific region. At present, the 3 member states from our region are the Solomon Islands, Japan, and Malaysia. The term of office of the Solomon Islands expires on 31st December 2021. The Regional Committee is now requested to elect one member state to succeed the Solomon Islands and serve a 3-year term starting 1st January 2022. The Regional Committee may wish to consider Tonga to be a member of the Policy and Coordination Committee and as such to nominate a representative upon WHO's formal request to the Minister of Health to serve on the committee for a 3-year term from 1st January 2022 to 31st December 2024. Thank you, Mr. Vice Chairperson.
Thank you, Dr. Capuano. Are there any comments? I see none. I take it that the committee agrees that the Tonga should serve as a member of a policy and coordination committee of the Special Program of Research, Development and Research Training in Human Reproduction. It is so decided. Honourable Ministers, let us move to item 17, and that is time and place of the 73rd and 74th sessions of the Regional Committee. May I now call on the Regional Director to say a few words regarding the venue and dates of the next 2 sessions of the Regional Committee. Dr. Kasai, over to you, please.
Thank you very much, Mr. Vice Chair. Last year, because of the COVID-19, we were forced to change plans and hold the regional committee meeting virtually. Japan, as our intended host, kindly agreed to delay hosting the meeting by 1 year, and now we are here in Himeji. And China, who had previously committed to hold the RCM in 2021, also graciously agreed to postpone. And before this meeting, I reconfirmed with China that they are kindly able to still host next year. It is therefore now proposed that China host the 73rd sessions of the committee in 2022. We would like to propose 24 to 28 October 2022 for the meeting, and China has advised me that it needs some more time to settle the style of the meeting and the venue, however. If honorable delegates agreed, I propose to confirm the details with China as soon as possible after the sessions of the RCM concludes and inform member states via note verbal. Regarding the 74 sessions of the Regional Committee meeting in 2023, and this is the meeting that the elections of the regional director will take place, and as such that we would like to propose that this meeting goes back to Manila, Philippines, at our regional office. Thank you, Chair.
Honourable Ministers, do representatives agree on Dr. Kasai's proposal? Thank you. Thank you very much. I understand that a representative from China would like to make a brief statement. Over to you, China.
谢谢主席。Thank you, Mr. Chair. Your Excellency, RD, Dr. Kasai, Ministers, Delegates, good day. As endorsed by the Regional Committee meeting, China will host the 73rd RCM for the year 2022. As an important member of the region, China has all along been a firm champion of multilateralism and long-term supporter of the regional efforts, and we have always been a staunch advocate of WHO's leading role in global pandemic response. The Chinese government has been implementing the Healthy China strategy, which is in alignment with the regional vision for the future towards the healthiest and safest region. In 2021, China successfully got the certification from WHO for malaria elimination. Since the onslaught of COVID-19, China has been deepening global cooperation in pandemic response, providing supplies, sharing experiences, and helping other countries, regional members included, to battle the pandemic. China stands ready to host the 73rd Western Pacific Regional Meeting with a view to further deepening regional cooperation among members, enhancing solidarity in the region, and advancing health in the region. At present, the world is still in the grim grip of the pandemic. It is not in the short term foreseeable how the pandemic may evolve next year. We still need time to observe the trajectory of the pandemic and the global response. For us to host sufficient risk assessment is needed before we can decide the time. But as RD has proposed 24th of October through 28th, and we will keep close contact on the dates with the WIPRO office. And risk assessment is needed before we can decide on the venue and modality of next year's regional meeting. We look forward to meeting all of you in China on next year's WIPRO meeting. And I believe, I'm convinced that we will provide you with a comprehensive and objective picture as to how China battled the pandemic. Thank you.
Thank you very much, representative from China. Are there any other comments? I see none. I take it that the committee agrees. Thank you very much. Honourable Ministers, let us move to item 18, which is the final one, the closure of the sessions. We now come to the closure of the session. I understand that the Secretariat has prepared a video recapping our meeting this week. Let's have a look. Please play the funny video.
Good morning and good afternoon, distinguished representatives, friends, ladies and gentlemen. I have great pleasure in declaring the 72nd session of the World Health Organization Regional Committee for the Western Pacific open. Last year, we met virtually. This year is the first time we are meeting in a hybrid arrangement.
Welcome to the city of Himeji. On behalf of our residents, it's my sincere pleasure to welcome the 72nd session of the World Health Organization Regional Committee for the Western Pacific to Himeji. I'm very glad to see you. Please enjoy staying in Himeji.
I have great pleasure in pronouncing the representative of Japan, the Honorable Hiroshi Yamamoto, State Minister, as chairperson.
Distinguished ministers, thank you very much, and I would like to express my sincere gratitude to you all for electing me to the chair.
A key topic of discussion this week is COVID-19. But this regional committee would also address 4 other issues that are important for achieving sustainable development.
Primary healthcare provides services that restore and maintain the highest level of well-being along the life course.
The regional framework on nurturing the health of our future generations in the Western Pacific.
In the Western Pacific region, communities use traditional and complementary medicine to treat a variety of health conditions.
Tuberculosis is one of the leading causes of death worldwide in the Western Pacific.
It's really important.
Like to understand the framing of thoughts for
WHO remains committed to supporting each of your countries to respond to the pandemic and to build forward better, in line with the general program of work and the regions for the future vision.
While many things in the world have changed dramatically in the past 2 years, but some have not. Include this region's unifying belief in health for sustainable future, and the importance of thinking about our own actions and how that affect the health and well-being of others. And I look forward with the hope and the confidence to continue our work together towards making this Western Pacific region the healthiest and safest regions around the world.
Honorable Ministers, I am so lucky that I have a recap of day 1 because I wasn't actually here. I understand that the representative from Malaysia would like to say something. Over to you, Malaysia. Thank you.
Your Honorable Vice Chair, first and foremost, I would like to appreciate and record our special thanks to the Regional Director, Dr. Takashi Kasai, for his excellent and exemplary leadership, coupled with his warm, engaging, and integrated approach. This pandemic has brought us closer over the last 22 months. Indeed, together we can make a big difference, and together we can make the impossible possible. The Regional Committee expresses its appreciations and thanks to the Government of Japan, Prefecture of Hyogo, and the City of Himeji for holding the 72nd session of the Regional Committee for the Western Pacific, the excellent arrangements and facilities provided, the gracious welcoming ceremony and hospitality throughout the event. Special thanks to the chairperson, vice chairperson, and rapporteurs for the excellent stewardship of the meeting, not forgetting the representatives of the intergovernmental and non-governmental organizations for their oral and written statements. Appreciation to the regional director and secretariat for their work in preparing for the session and the hybrid meeting arrangements. So once again, let me conclude by thanking all of you here in the hall and virtually for your time and valuable insights and active participation. Indeed, you are shaping on the importance of engaging discussions, putting tools together, and offer options for policy making in place that member states can use to advance sustainable development. Malaysia would, and all of us would look forward for the next RCM in China in 2020. And more importantly, ladies and gentlemen, I think please give RD and the Secretariat a big hand and round of applause. Last but not least, I think we look forward for the next RCM China. And in the meantime, stay safe, mask on, arigatou gozaimashita, sayonara, and thank you very much.
Thank you very much, Malaysia. Are there any comments on the Honourable Delegate's proposal? I give the floor to Japan.
Thank you, Mr. Chair. It is our honor to host this 72nd session of the World Health WHO, the Regional Committee meeting here in Himeji, in close collaboration with the local community, city of Himeji, and Hyogo Prefecture. And I'm very pleased to see all the discussion in this meeting was quite fruitful, and also all the preparation, logistical preparation was so smooth. At first, we are not sure whether we could make this hybrid, the meeting could be done, as this is the first trial after this, during this pandemic season. And I'm very pleased to see all these arrangements well done. And this couldn't been accomplished without a close support of everybody, member states, Dr. Kasai and his team, and also our colleagues. And with all the collaboration of all the members, we could accomplish this meeting quite successful. I'm very pleased to see the actual accomplishment of these meetings, and also thanks to everybody, especially the secretariat of the UPRO colleagues. I know that behind the scene, they're actually working tirelessly night and day, and I'm very much appreciate again, especially to the secretariat of the UPRO colleagues. And also, lastly but not least, the interpreters who could actually serve behind the scenes. And I actually see sometimes in Japanese, sometimes in English, and I know that how accurate and precise their translation and interpretation is. Thank you very much again. Thank you, Mr. Chair.
Thank you very much, Japan. I take it that the resolution is adopted by the committee. Thank you. Now, before we conclude, I understand from the Secretary that a draft report of the session will be sent to each representative who has been present, with a request for comments. If no comments are received by the due date, the draft report will be considered to have been accepted. May I now call on the Regional Director to say a few words. Your Excellency, Dr. Kasai.
Thank you very much, Honorable Vice Chair, Honorable Ministers, and distinguished delegates. I think this meeting will be remembered that we are all connected in this historical city, Himeji, while we are all together in this COVID-19 response. But in the meantime, we discuss how we can get out of this COVID-19 together. And I would like to appreciate everybody being connected in this Himeji, those who are here with us in Himeji, and everybody connected virtually. The past 22 months, or say past 1 year, was another very difficult year. But I was very pleased to hear that the member states gain more and more experience, and we have another tools in our arsenal. And I was also very happy to hear during these sessions that while we're responding to COVID-19, member states move the vision for the future. We made a strong progress on our technical agenda item this year on school health, tuberculosis, traditional and complementary medicine, and primary health care. And I appreciate your collaboration in the leading up to these discussions, and we're very much looking forward to implement those the agenda that we have adopted. Additionally, we held a side event on innovation, mental health, and communications for health. And I was very happy to hear the very positive feedback on this. And I very much appreciate also your advice, how we can continue to move forward these 3 areas of agenda. And what I have heard from many member states during this session is that we have experienced and observed so many things throughout the COVID-19 response. And it's our responsibility to make sure that those experience and observation to be reflected in our work for the future, so that we can make sure that these regions continue to be, or I would say, to make this region one of the healthiest and safest regions. I'd like to thank our excellent office bearers, Chairperson Honorable Hiroshi Yamamoto, the State Minister of the Ministry of Health, Labor and Welfare from Japan, Honorable Vice Chairperson, the Honorable Isaiah Baipuna Tape, the Minister for Health, Welfare and Gender Affairs from Tuvalu, and Dr. Wan Nurani Wan Mohamed Noor of Malaysia, English Rapporteur, and Mr. Thibault de Monouf of New Caledonia, our French Rapporteur. We have, as our traditions, prepared some small gift as token of our appreciation, which we will hand out now. And could I please request the representative from Japan to accept a gift on behalf of the State Minister Yamamoto, please. Yeah. It's quite heavy. So really, thank you very much. Next, could I please request Honorable Minister Tape to please accept our gift? Really, thank you very much for your time. Thank you very much. We're very fortunate that you are here. Thank you very much. And of course, Dr. Wan, please, can you come forward? Really, thank you very much for your hard work. Virtual rapporteur. Thank you very much. Okay. And for Mr. Thibault, is he on the screen or? Really, thank you very much supporting this rapporteur meeting virtually, and I assure you that we'll be putting your gift in the mail. So really, thank you very much on behalf of all this committee. Oh, thank you. There. Thank you. Merci beaucoup. Now, this meeting, we set forth two bold ambitions. One is to promote risk-based approach, and the second is trying to establish a new style of meeting, hybrid meeting. I'd like to conclude with the effort of Himeji City, Hyogo Prefecture, Government Japan, and all our staff. But more on that, all the participants. I'm very happy to see that we reached this point. Of course, we learn a lot, but I think our region's principle is that continue to learn and improve, and hope this experience would give us a foundations to move us towards the COVID-19 as an endemic and continue to promote this approach. So I really wanted to thank our WHO staff, Government Japan, Hyogo Prefecture, and of course the leadership of the Himeji City and people of Himeji for taking up the challenges of organizing this meeting in this very difficult time. So really thank you very much. I wanted to really thank you again. Distinguished representative, thank you very much once again, your participation and support. Please stay healthy and safe, and I look forward to seeing you again. I hope that will happen very soon. Thank you very much, sir.
Thank you, Your Excellency. On behalf of the member states, I would like to thank you. Whakatailasi, arigatou taimasta, vinagavagalevu malolelei, to Dr. Kasai and the Secretariat for their dedication and hard work for this session of the Regional Committee. If there are no further comments, may I now declare the 72nd session of the WHO Regional Committee for the Western Pacific closed. Thank you very much.
您好，我是阿加莎，非常高兴认识您。
老头子，下周准备吃点啥？
油炸茄盒。
油炸的不健康。
糖醋排骨。
糖醋的糖又太高了。
红烧狮子头。
你也不能多吃。
这也不能吃，那也不能吃，叫我吃啥？
就知道问你也不靠谱，还是问问阿加莎吧。
饮食要均衡，健康的饮食有助于预防各种形式的营养不良以及非传染性疾病，包括糖尿病、心脏病、中风和癌症。健康的饮食结构为每天2.5杯5份蔬菜，2杯4份水果，180克谷物，160克肉和豆类，每周吃1到2次红肉，家禽每周2到3次。
就这么吃。
Recording stopped.
您好，我是阿加莎，非常高兴认识您。
老头子，下周准备吃点啥？
油炸茄盒。
油炸的不健康。
糖醋排骨，
糖醋的糖也太高了，
红烧狮子头，
你也不能多吃啊。
这也不能吃，那也不能吃，叫我吃啥？
就知道问你也不靠谱，还是问问阿加莎吧。
饮食要均衡，健康的饮食有助于预防各种形式的营养不良以及非传染性疾病，包括糖尿病、心脏病、中风和癌症。健康的饮食结构为每天2.5杯5份蔬菜，2杯4份水果，180克谷物，160克肉和豆类，每周吃1到2次红肉，家禽每周2到3次。
就这么吃。